I just want to touch on a few things about chemotherapy because that has been the standard for many years that we have used and we're still utilizing quite often. And so I usually start off explaining what of the side effects of chemotherapy are. Chemotherapy, the actual word means cell killer. It's cytotoxic. That said, the fastest growing cells in our body are obviously the cancer cells. And like I tell some of our patients that if you are human, you're at risk for cancer. And some of the other fast-growing cells in our body are our bone marrow. And the bone marrow is where our blood cells are produced. And this is the spot where your side effects usually are presented because of the bone marrow being affected. And I try to tell my patients when you're getting chemotherapy, these are the greatest risks to be aware of. Is our white blood cells are produced in our bone marrow, our red blood cells are produced in our bone marrow, and our platelets are produced in our bone marrow. We like to reiterate how important it is to call us immediately for any signs of infection. And I will tell you some of the signs of infection. Number one is a low-grade temp. You might start to have a temp of 99, 100.4, and that's the magic number. 100.4, if you start to have a low-grade temp, you need to call our office and let someone know. We do have a triage line, and we have a nurse on that line Monday through Friday. 9 to 4, and we will take your side effects and see what's going on. If you have a temp, you have shaking chills, you have other signs of infection can be a pneumonia could be developing, which is you're having difficulty taking a deep breath and you have a new cough. That's a sign of infection that we usually see if your counts are low and you're not feeling well. The other source of infections are urinary tract infections, and so we tell you the signs of signs of urinary tract infection is painful urination, foul-smelling urine, or difficulty urinating. So those are things and reasons for you to call us. And some of you don't know what a port is, but if you do have a port placed, it is a source of infection. So we'll always tell you if that port that we've placed in you has a redness or it's sore and it's swollen, that's a reason to call us. So those are the major things we need you to do to call if we're giving you chemotherapy, because again, it's a cell killer. The other cells that are affected are the red blood cells. You can become anemic. Most of the time that your body recovers. Each time we give you chemo, it can be cumulative, which means that your counts may drop and stay low for a longer period of time. If you're anemic and you're very anemic, we may determine you need a red blood cell transfusion. We will talk to you about that and we'll see what your side effects are. If you're having symptoms of anemia, then we're more apt to give you a transfusion. If you're not having symptoms and you're just a little tired, the doctor will hopefully let your body recover on its own. And signs of anemia are shortness of breath, you're exhausted after just going a couple of flights of stairs or a couple steps of stairs. Those are signs of anemia. If your platelets go low, that's you're clotting. That's how your body clots. So if you get a cut and you're bleeding, and the cut scabs over, that's a clotting. If you cut yourself when your platelets are too low, it's very difficult for that bleeding to stop. In that case, if you have a nosebleed that you can't stop, that could be that your platelets are very low. So we tell you, if your nose is bleeding and you can't stop it, you need to call us. If you see blood in your urine or if you see blood in your stool, that's a reason to call us. Those are extremely important things and you need to call us immediately. And we like you to call our practice during business hours. There is a physician on call around the clock. During our hours, we would maybe have you come and be evaluated by one of our clinicians, one of our APRNs or one of our physicians, and we do lab work and determine what is going on and try to take care of the problem here in our office, since we're the ones giving you the chemotherapy. But in all course of cancer treatment, if you're feeling lousy and you aren't able to get in touch with someone, which usually isn't the case here, we're right on top of it, we will tell you to go to the ER. And don't be afraid to go to the ER, because we don't want you to, be compromised in any way whatsoever.